this session. And if you have a colleague that may have missed the session, we will be, just a reminder that we are looking to post these sessions on YouTube for those that are not able to make the sessions, can refer to later. So welcome everyone. Welcome to the PRAPARE Tiger Team. Next slide, please. So this is session 2. In session 2 will be why screen for SDoH and why use PRAPARE. So this is session 2 of 2023's Tiger Team. In terms of the agenda, next slide, please. In terms of the overview, today we will be providing a high-level overview of what is SDoH, provide an overview of PRAPARE, the impact of using PRAPARE, and finally, we will then open up the floor for a Q&A session. Next slide, please. Participant engagement. Throughout the Tiger Team sessions, there's a wealth of experience and expertise from each Tiger Team participants. So we will be looking to engage you all, and we will be using the Zoom platform. Please feel free to raise your hand. We will be using the chat, and please feel free to react to some of the things that we discuss. And we will be having polls as well. Next slide, please. So this is our team of Tiger Team facilitators. Today, you will be hearing from me, Chloe Destinoble, and you will be seeing my colleague, Jessica, as well, who is joining us today, and she will be providing me with some tech support throughout this session. So while this presentation is being led by NAC, I'd like to point out that PRAPARE was created in collaboration between NAC, AppShow, and OPCA. So right now, next slide, please. We would like to know who is in the room. So in the chat, please feel free to drop in your name, title, and your organization name. We'd like to know where you are joining us from.
Name and something. Definitely not gonna do that until everyone else does that. Oh, okay. That is not a name. I don't think. No, Lucinda, that is your name. Oh.
Hello, Rebecca. Thank you for joining us. Hello, Renee. Thank you for joining us from Minnesota. Kevin, Hannah, Shannon, you're back. Hi, nice to see you. Stu, who's joining us from Maine, Molly. Thank you, everyone. Continue dropping those in. So right now, I'd like to launch our first poll, our who's in the room poll. We'd like to know some of these questions. We want to know, is your health center currently collecting social needs data, as well as what is your level of understanding with social drivers of health?
Yes. Just gonna bust our eardrums and
So we'll wait until about 60% of our participants answered, and then we will end the poll.
All right, Chloe, we're at 61%.
Thank you so much, Jess. And we can go ahead and end the poll and show the results.
Can you see those?
Not seeing it, no. Is everyone able to see it or no? So right now, currently we are seeing that 65% of our health, in terms of, is your health center currently collecting SDoH, social needs data? 65% answered yes, you are using PRAPARE. And right now, 34% yes, but you are using another screening tool. 24%, I will go ahead and read the results out loud, just so no worries. Thank you for that. And no, 24% answered that no, not currently collecting social needs data. Thank you for participating in that. And then our second question is, what is your level of understanding with social drivers of health? So we really wanted to ask this question because for this session, we are really going to get into it. We're going to provide an overview of what SDoH is and why it is important for you to collect. So 9% indicated that of our participants indicated that they are new, it was 3% indicated that they are new and they are not knowledgeable. No worries, we will be providing an overview of SDoH. We have 26% who of our participants who indicated that they are beginner and somewhat knowledgeable. And 44% of our participants consider themselves intermediate knowledgeable. And then 26% is of our participants are considered advanced and very knowledgeable. So this presentation is we'll be covering all of that, and it's a good presentation for wherever you are at. There is always something to be learned about social drivers of health. So now for our next slide, please. For our learning objectives, we will be defining social drivers of health and the impact on patient health outcomes. And secondly, for our learning objectives, we understand how PRAPARE enables health centers to better understand patient complexity, address social risk, and demonstrate value. So, if you can go back to our definitions, please. Thank you so much, Jess. There are a lot of terms that are used within healthcare, and it's always good to step back and define some of the terms we use. It can get confusing, especially since a lot of these terms are used interchangeably. So for one, social drivers of health is the condition in which some people are born, grow, live, work, and age. These conditions are shaped by the distribution of money, power, and resources. It makes clear that the term itself, SDoH, is neither positive nor negative. Each of us as individuals have social determinants of health that impact us. 2, social risk factors, specific adverse social conditions that are associated with poor health. By identifying individual level social risk factors, health systems could devise interventions to address them specifically or address data to understand where community level interventions might improve a population's health. And 3, social needs, patients' role in identifying and prioritizing social interventions, identifying what is most important to patients. And then we have population health, is the health outcomes of a group of individuals, including the distribution of such outcomes within the group. So typically we can look at our patients' population at the health center. These terms are interconnected but they each mean something different. Hopefully this provides some context as we move along in this presentation. So why are social drivers of health important? As the driver of health inequities, social drivers of health have shown a greater impact on population health and individual well-being than factors such as biology, behavior, and medical care. So as you can see from this illustration, you have about 40% of our overall health is socioeconomic factors, 10% is a physical environment, 30% is health behavior, and 20% is healthcare. medical care although essential for health, has shown to be relatively weak influencer of health, and that has been estimated to account for only 20% of the modifiable contributors to healthy outcomes for a population. The other 80 to 90% have been attributed to the social, economic, and environmental factors referred to as social drivers of health, or as a lot of people know it, as social determinants of health. Next slide, please, Jess. So now, why collect standardized data on SDoH? This leads us here. Health centers and others are increasing their use of social risk screening tools, such as PRAPARE, to better understand, document, and address the root causes of not just poor health, but of inequities. Having this data integrated into systems can allow teams, and internally and externally, to collaborate to proactively access and address client social risks, and can also be used to guide local partnerships in accelerated alignment. This diagram provides an example of the use of cases of social interventions documentation from patient to policy level in alignment with this vision. And then this slide also, go back, please, Jess, if you wouldn't mind. Thank you. And then this slide also illustrates our thinking and our experiencing coming from our prior work in bringing patient-level SDoH screening to scale across health centers. This data can be used for better care delivery planning from the patient all the way to the system and policy levels. As health centers are increasingly committed to standardized social risk screening, our work can maximize the impact of that data towards building system capacity for health equity and accelerating the alignment strategies that can make that happen. So now this brings us, next slide, please, Jess. So now this brings us here. So that was an introduction of SDoH and why we collect that. So now we want to get into PRAPARE. What is PRAPARE? PRAPARE stands for Protocol for Responding to and Assessing Patients' Assets, Risk, and Experiences, a national standard, which is a national standardized risk assessment tool designed to engage patients and assessing and addressing social drivers of health. Next slide, please, Jess. Excuse me. So what does PRAPARE measure? As the driver of health inequities, social drivers of health have shown a greater impact on population health and individual well-being than factors such as biology, behavior, and medical care, as we previously discussed. Community health centers have always worked with their patients and communities to address SDoH needs. So in 2013, NACHC and OPCA collaborated to develop the PRAPARE screening tool. Through a meta-analysis of the existing evidence-based and risk assessment tools resulted in a core list of 16 domains and questions for inclusion in PRAPARE. It was iterative, excuse me, I was letting someone in. It was an iterative process using expert panels, subject matter experts, and users in the field. The 9 measures that are, there's an echo. Okay, perfect. So if you have a question, excuse me, please feel free to drop them in the chat, and then we will pause to take some questions throughout as well. So the 9 measures that are outlined in red, as you can see, are reported by health centers as a part of UDS. On the right are optional and optional granular measures. Health center staff agree that these measures are important, but health centers should decide whether or not to use them based on staffing and resources available at their health centers. So the great thing about the PRAPARE tool is that you can tailor it based on the needs of your community. It is a tool that is evidence-based, designed through stakeholder engagement, paired with an implementation and action toolkit, and standardized across ICD-10, LOINC, and SNOMED.
Natural language processing. What we
And thank you, Jess. Next slide, please. So according to UDS, 2021 data, PRAPARE was the most dominant SDoH standardized screening tool used by health centers. Our team is actually really excited that there was an increase in health centers using PRAPARE from 35% in 2019 to 54% in 2021. And as of late, we've been getting a lot of inquiries through our mailbox of health centers and reaching out to us, asking us about support in terms of how can they incorporate PRAPARE into their facilities. So we're actually really excited about this. Next slide, please, Jess. Okay, so when we look at PRAPARE Reach, this slide has 3 different maps, which shows the levels of PRAPARE used by state according to UDS data. The map on the left is from 2019, and it depicts the reach of PRAPARE at community health centers through 2021. As you can see, the map gets darker in blue over time. The darker it is, that means like the more percentage of health centers that we currently have using PRAPARE as their choice of standardized screening tool. Thank you, Jess. So why use PRAPARE to collect SDoH? PRAPARE, a tool that is evidence-based, designed through stakeholder engagement, paired with an implementation and action toolkit, and it is standardized. It is actionable. PRAPARE has a free implementation and action toolkit to support users in implementing PRAPARE and taking action on patients' social needs. It standards and widely used, standards the needs rather than the question, and measures linked with standardized codes. So ICD-10, LOINC, and SNOMED. It's evidence-based and social stakeholder driven. PRAPARE was informed by the existing evidence based on social risk and national efforts to address social risk. It was also built, vetted, and tested with health centers and healthcare organizations across the US. It's designed to accelerate systemic change. PRAPARE can be used to show patient complexity throughout the development of risk stratification, formulas, and ensure ability to better target complex patients in need of enabling services and social interventions, such as referrals and case management. And patient-centered, which is the most important part of the why of PRAPARE. PRAPARE was created in a way to facilitate conversations and build relationships with patients. We have heard from many health centers that PRAPARE has helped them build relationships with patients. PRAPARE has been translated into 26 languages and has a decline to answer option for all questions to respect patients' choice to respond. Next slide, please. So we would like to go over the impact of not doing PRAPARE screening. To illustrate the importance of the inclusion of social needs screening and social intervention, I will describe 2 case scenarios, one that includes social needs screening and one that excludes. We will start with the scenario that excludes the social intervention. Here, as you can see, we have Maria, who has a medical history of uncontrolled diabetes. She has missed appointments and poor medication adherence. She has fallen asleep at the stove that almost caused a fire. She is diagnosed with sleep apnea, hypertension, and dangerously high blood sugar. For this diagnosis, she is hospitalized and receives a prescription for hypertension medication in a CPAP machine. 2 weeks later, Maria is back in the hospital with the same clinical symptoms, during which there is a SDoH intervention where the care team discovers that she has not taken her medicine or using the CPAP machine because she cannot afford them. So now, if we take the same case with Maria and include social needs screening during her hospitalization, we can see that the care team is able to identify that Maria has not taken her medicine or used a CPAP machine because she cannot afford them. As a result of administering PRAPARE, the care team is able to identify her needs and works to assess eligibility and enroll Maria in public insurance, and also provide a referral to a CBO for additional resources. Care team members follows up with CBO to check on referral and assist Maria. She is monitored for treatment plan and is seen before the 2-week mark due to her recent hospitalization. So as we see, when there is the SDoH investigation throughout here. So the key items to note here is that Maria did not return to the hospital within 2 weeks, preventing the same clinical symptoms as she did in scenario A. And teams internally and externally collaborated to proactively assess and address Maria's social risk and needs. So because of the fact that they were able to look into some of her needs, they didn't just throw the patient back into the same environment that basically caused them to be hospitalized. That social intervention, finding out what her needs are, they were able to see where she lacked resources, and they were able to provide such resources for her to prevent her from being hospitalized again. Are there any questions at this time? No? Okay. So for next slide, please, Jess. So right now, these are some of the examples of how PRAPARE has been leveraged to align with health center efforts on value-based care, payment reform, PCMH recognition, quality incentive programs, and community health worker programs. PRAPARE was developed to align with and not replace health center efforts, which we want to know, Jess, if you wouldn't mind launching poll number 2 for us. We'd like to know which of these opportunities to leverage PRAPARE are you currently doing? So we're seeing some responses come in. We're seeing a lot of PCMH and QI incentives, community health worker initiatives, once we get to about 60% of those answered, then we can go over those results.
It looks like we're at 48 or 50%, Chloe.
Okay, I'm okay with that. So thank you so much, Jess. So continue sending those in. Right now, we are seeing that majority answered that PCMH and QI initiatives are some of the opportunities that they are currently doing. We're seeing community health worker initiatives I love that, as I used to work with CBOs and work with CHWs. I love that community health workers are being used currently to leverage PRAPARE. We're seeing data sharing and aggregation opportunities at 30%, delivery system transformation activities at 23%, and quality and incentives that reimburse for screening and social needs and social risk at 20%. Thank you so much, Jess. We can go ahead and go to the next slide. So as I provided, go ahead to the knowledge check. Thank you. So I know I provided some information currently, so we'd like to go ahead and do some knowledge checks. We want to know, Jess, if you wouldn't mind launching knowledge check number 1 for me, please. So we'd like to hear from you. If you can answer some of these questions for us, just to see some of the information that you were able to retain. We want to know social drivers of health include which of the following? And the next question is, what percentage of a person's health is impacted by SDoH? Question number 3, PRAPARE stands for which of the following? And then a true or false, PRAPARE data can be used for change at the patient level, population level, and community level. So we're pretty much at 60% right now. Thank you, everyone. I'll give everyone, perfect, thank you, Jess. And now I'd like to go over some of these questions. So when asked, social drivers of health include which of the following? Majority of you answered that correctly at 95%. So that's great to know that as I provided this information, it was retained. So yes, it does include all of the above. The conditions in which we live, the conditions in which we work, and the conditions in which we play, all is included in social drivers of health. And then question number 2, what percentage of a person's health is impacted by SDoH? Again, majority of you all answered that correctly. So if you answered 80%, you are absolutely correct that it is 80% of a person's health that is impacted by SDoH. Next slide, please, Jess. So we wanted to know, PRAPARE stands for which of the following? The correct answer is, and majority of you got that correctly, 95% answered the protocol for responding to and assessing patients' assets, risks, and experiences. And then finally, question number 4, PRAPARE data can be used for change at the patient level, true or false. PRAPARE can be used for change at the patient level, population level, and community level. I'm happy to report that all of you got that correct. 100% of you answered true, and that is the correct answer. So right now I'd like to pause to see if any of you have any questions regarding some of the knowledge check questions. We're good, we're good, okay, perfect. So next slide, please, Jess. So building capacity to respond to SDoH needs. Building capacity to address social determinants of health begins with an assessment of your organization's current capacity. You want to know, like, what resources does your organization have available to focus on addressing identified needs, and in what context do these resources exist? Are they internal to your organization, or do they exist outside of your organization? Consider the following resource categories when you assess resources within your organization to address SDoH needs. You want to think about people, processes, and technology. These categories are all interrelated, and a change in one area will impact the other areas. So when you think about people, you want to know, do you have staff time that can be dedicated to social determinants of health focused initiatives at your organization? Another question to think about when you're thinking about people is, are these specific roles, e.g. community health workers, focused on addressing a patient's social needs? And where you think about processes, the questions that you want to think about is, do you have referral workflows in place for connecting patients with resources to address their social determinant needs? And have you formed partnerships with external organizations such as local food banks and employment agencies? And finally, when you think about technology, you want to know, do your EHR support or systemize social services? And finally, are you able to share data with external organizations? Next slide, please, Jess. So we want to provide like some basic best practice when we talk about PRAPARE. When speaking about PRAPARE, it's important to do not use the word project, as that is something, it would indicate that something is ending. It is better to frame PRAPARE in SDoH work as a way to achieve your mission of improving health. So you've heard us refer to it as a tool, and that is a great way to go about doing that, a tool to reach your some of your goals that you have at your facilities. It's important to not assume stakeholders have familiarity or understanding of PRAPARE at the onset. Next slide, please. So when we talk about action steps to engage stakeholders, with any new initiative, it is important to engage stakeholders who have an interest in the success of the project. Involving people who will be impacted by the initiatives can lead to strong support of the project and can strengthen the process and or outcomes of the project. For example, engaging staff can lead to the development of more appropriate workflows to collect and act on the social economic data. Engaging patients can lead to more appropriate interventions or community partnerships. There are many ways to engage stakeholders, ranging from education and consultations to direct involvement in the project process. Some stakeholders may desire and have the capability of engaging in a more active and direct way, such as helping to define priorities, collect the data, interpret the findings, act on the data, develop community advocacy plans. Other stakeholders may desire or only have the capability of engaging in a more passive, advised at meetings, providing feedback, etc. And what is important is engaging and educating stakeholders so that they can make an informed decision as to how they would like to be engaged. Next slide, please. So when developing resources such as community resource guide that maps to prepare, identify assets, risk, and experiences, engage in a wide variety of staff and patients, as they may be knowledgeable about resources available in the community that you or others may not be aware of. So flyers are a great way to educate patients and the community on the purpose of PRAPARE and how data will be used to inform care and services at your organization that can be placed throughout your organization for patients to see, La Clínica de la Raza and California developed PRAPARE flyers in English and Spanish to communicate with their community. As I've implemented some scribe programs, and we've actually used PRAPARE. And one of the things that as I implemented this project is we had to gather some of this questions from the PRAPARE toolkit. And it was very important to actually inform the scribes why they are collecting this, and they are more likely to do it and actually move on with the process. So it's important for people to know what it is and how it is helpful. So versus just telling them to collect it. So that open line of communication works well. For organizations that are supporting members and implementing PRAPARE, consider building a website to house your resources and training materials. Host a shared calendar of events, share results and lessons learned to engage in discussions. The Minnesota Association of Community Health Centers developed a website for their members that helped facilitate engagement and shared learning. Next slide, please. So these are some common challenges of messaging solutions. So state or organization already committed to other SDoH tools, AHC, homegrown, do crosswalks that map other tools with PRAPARE to show similarities and differences. Message importance of standardized data and codes. Next. So competing priorities, PRAPARE will value to other initiatives, PCMH, ACO participation, payment and reform. Next one, please, Jess. So how do we implement this without increasing? Another common challenge is how do we implement this without increasing visit time? Identify value added time, whether it is in waiting rooms, during rooming process, or after clinic visits. And the next common challenge is inability to address SDoH. You have to start somewhere and do the best we have to do the best that we can with what it is that we have. So collecting information will help us figure out what services to provide. So it's better to do something than nothing at all. So you have to actually start somewhere. And the next common challenge we have is staff turnover or at CHCs, PCAs, and HCCN levels. You have to involve multiple staff in PRAPARE training so that work can continue and share the care. So that's what I was saying in terms of me serving as a scribe early on in my career. We were actually involved in this process because as we are documenting for the providers, we were able to they were able to incorporate scribes into this process. So that way it wasn't just one person's responsibility, because what happens if that person isn't here? Then there are multiple people that are trained to do so. So it is a share the care experience. Next one, please, Chas. And finally is fitting PRAPARE into workflow. You have to incorporate into other assessments to encourage completion. So whether that's health risk assessment, depression screening, PAM, etc. So go ahead, please. Next slide, Jess. So when patient two responds to data collection, this is a patient perspective. A pilot conducted by the OPCA in 2018 reveals the following from 132 patients screened using PRAPARE by staff who have trained in empathic inquiry. So 91% of the patients indicated that having conversations about their socioeconomic circumstances built stronger relationships with the care team. 97% agreed that SDoH screening was a good use of time, even though 56% of them had never met their interviewer prior to this conversation. 80% strongly agreed it was appropriate to be asked about their social needs. And over 70% strongly agreed they knew more about how the organization could assist them with non-medical needs than they had information to reach out to new resources. Over 50% of patients said they would like to be screened for SDoH visit. So it's all about how you approach it. You really have to think about it as a conversation starter. So which is what brings us to our next slide. When you think about PRAPARE as a conversation starter, these questions are meant to build better relationships between patients and a staff that will inform the process to better care. Use empathic inquiry, talk story, or motivational interviewing techniques to talk compassionately and reflectively with patients. In my past career, I've also served as a COVID contact tracer, and we were calling people and we were asking them about these things, whether figuring out like what resources that do they have to possibly isolate or what have you. Not everyone is willing to have that conversation. We basically had a script to do that, but you have to turn these questions into basically a conversation starter. One question will actually lead you to another, actually voicing what it is that you are collecting and why it is that you are collecting such information will bring you a long way, because you have to know your community and the target audience that you may have. Any questions currently?
Yeah, Chloe, I saw a few questions come through the chat. So, and let me know if you want to save these till the end.
Yeah, we can, some of these questions we can definitely save through to the end. We're actually almost at the end, so we can take the questions then.
Okay, thank you.
Perfect. Thank you, Jess. So Jess, at this time, if you'd be able to launch our second knowledge check for me, please. So we'd like to know action steps to engage stakeholders include which of the following, and true or false, visualizing PRAPARE data is a great way to sustain engagement and motivation. And true or false, PRAPARE questions are meant to build better relationships between patients and staff, and PRAPARE will inform the process to better care. And we're actually at 59%. That's perfect. We're actually at 60% now. So we can go over our next question. Next slide, please, Jess. Our next set of questions. Okay, so when asked, action steps to engage stakeholders include, I'm happy to report that 100% of you got that correct. Yes, it actually includes all of the following. It includes get feedback from staff, board, and patients in planning stages, identify PRAPARE champions, plan opportunities for shared learning. That is correct. And then, so if you answered all the above, you are correct. And the next question, true or false, visualizing PRAPARE data is a great way to sustain engagement and motivation. And 100% of you answered that correctly. It is true. Visualizing PRAPARE is a great way to sustain engagement and motivation. And finally, true or false question. It is true. PRAPARE questions are meant to build better relationships between patients and staff, and PRAPARE will inform the process to better care. This is exciting to know that all of these questions, 100% of you answered them correctly. Thank you. And if you can bring us to our next slide, please, Jess. But before I get into the next slides, I wanted to know if anyone has any questions regarding the questions that we just answered. If not, then we can continue moving and grooving. Perfect. Go ahead and click for me, please, Jess. We'd like to provide a case study because some of the common challenges is a lack of resources and actually to implement PRAPARE. So we want to go over these case studies. The first case is a great example of how to implement SDoH screening tools with minimal resources. So over here, Marin Community Clinics, MCCs, administered PRAPARE to patients with uncontrolled diabetes. The problem is, let's start with the problem. MCC wanted to take advantage of value-added time while patients were waiting to see staff or providers. So they decided to have patients self-administer PRAPARE on paper. So how they went about this intervention is at check-in, the front desk staff handed patients the paper version of the PRAPARE form, which is available for you all on our website, which patients completed on their own while waiting to be roomed. So it's all about finding out your workflow, your community, and how to go about doing this. And the impact that had based on the intervention that they had is MCC was able to implement SDoH screening with minimal resources. MCC used data to create one-page resource list for community services in both English and Spanish, so catering to the needs of their community, catering to the people that they serve. They improve awareness for staff, providers about the importance of social determinants. So MCC administered PRAPARE to patients with uncontrolled diabetes and hypertension, and patients referred to the MCC patient navigation team on their results from the Staying Healthy Risk Assessment. MCC piloted PRAPARE at 2 sites, actually. They actually did this at 2 sites within the same community to increase the screening rates. The pilot of PRAPARE to get staff buy-in, MCC wanted to take advantage of the value-added time. So the patient's self-administered paper, while they were waiting for this saves the clinic staff time, and it adds value by using the time to collect the important data. And a self-administered screening tool allowed MCC to begin gathering SDoH data with the minimal resources that they did have. So the data that they provided, they created dual language resource pages containing local services. It also increased among clinic staff about the social determinants of health and how they can be forced to bring about health equity through SDoH collection. And the next case study that I wanted to go over with you all is case 2. San Isidro Health in California administered PRAPARE with 3 different target populations. Their problem was that using PRAPARE at SYH learned that transportation was the immediate concern among patients. So they had they served 3 different target populations. So 1 patient with diabetes or hypertension, 2 patients with a behavioral health diagnosis, and 3 care coordination enrollees. Care coordination is administered PRAPARE during outreach calls to schedule patients for appointments or during care coordination visits. So the effective strategies that they used, they were strategic about the implementing PRAPARE and promoting its use among staff. They focus on the pre-primary care experience. And then 3, they track next steps to close the loop. And the impact that this had is that it established partnership with 21 to integrate community partners into population health and manage platform. 2, deployment of mobile health clinics to communities with transportation issues. And then 3, develop neighborhood health days that reach entire households of patients. So as they use the prepared and identify that transportation was the immediate concern among its patients, acting on this data, they were able to, I misspoke. They actually established 211 to integrate community partners in population health management. And because transportation was the most pressing need of its patients, it deployed mobile health clinics. And additionally, SYH developed the neighborhood health days as we previously discussed. So SYH did not have specifically effective strategies to achieve, they did have specifically effective strategies to achieve these results. And those were the ones that we provided up here. So now, based on the matrix from the previous slide, we can likely locate San Isidro Health to be in the top left quadrant, where an organization may have many internal resources or greater internal capacity to respond to SDoH, because as we know from case 1, they lacked resources. So this would put San Isidro at the top left quadrant. Screening by few community resources. This allowed them to build in-house services like the mobile health clinic to respond to patients' needs. So now I'd like to, next slide, please, Jess. So now I'd like to open up the floor for any questions that we may have. And please feel free to come off mute and as we discuss these. And this is a bi-directional effort, so we encourage learning from one another. So if someone may have a question, whether it's examples or such, please feel free to come off mute and let's collaborate that way. But I'd like to open up the floor.
And I can get us started by reading some of the earlier questions in the chat. Let me go back to them. I saw a comment from Rebecca. Formal recommendations for community health center workflows that include designated staff roles would be beneficial. This is one of the things that is most often requested as a reference. And then Shannon asked, does NAC have any crosswalks of various SDoH screening tools that we can view?
Actually, Shannon, I will go ahead and discuss with the rest of the team. And if you wouldn't mind sending that question to our prepare inbox, and we will follow up on that for you. So it's prepare@nac.org. For sure. So Shannon says she has a couple of ideas regarding the Prepare 2.0. Yes, it is still in piloting stages, but yes, Shannon, please feel free. You can just actually send that to us like a 2-part, sending us that question and as well as the ideas that you have regarding Prepare 2.0. And we'd be happy to collaborate with the rest of the team and get back to you on that one. So please feel free to send those over to us.
And then one last comment from Judith. In the prepare forms we have built into our platforms, we ask, have you had difficulty in paying for or obtaining ... in the last year? And that, you know, including adequate food, transportation, childcare, housing, utilities, etc.
Yes, for sure. And that's one of the pieces where we spoke on earlier. You are able to tailor some of these questions to meet the needs of your community. So if you'd like to expand on some of these questions, that's perfectly fine. We actually welcome it. If there are no additional questions, then we can move on with our announcements, please, Jess. So right now, next slide, please. So right now, the SDoH team at NACC would like to learn about how PRAPARE is being used to assess and address social needs of patients within dental clinics or oral care programs. We strongly recommend that this brief assessment is completed by someone that oversees SDoH screening, which includes PRAPARE at your organization, or how PRAPARE informs patient care and oral health programs. So even if you don't necessarily do so, if you know someone who does, please feel free to share this with them. You can scan the QR code that will take you directly to the survey, or we did send out this information via email on Friday. So please feel free to refer to it. If you have any questions, if you have any additional questions, please email prepare@nacc.org. Or if you'd just like to loop in whomever that you know that is currently doing so to us, we'd be happy to share this link with them. And we would like to close out by thanking you all for joining us today. If you have any questions, please feel free to email us at prepare@nacc.org. For more information, please visit prepare.org. And on there, we have our resources listed for you all as well. Please feel free to send any questions that you may have, Shannon. I'd actually be looking forward to discussing with the team these ideas and this question that you have. So please feel free to continue sending them our way. If there are no additional questions, we will close out again by thanking you all for taking the time out to join us, and have a great day. And I'd like to also thank Jess for providing tech support throughout this presentation. And again, thank you all for joining us. Have a great day.